Hello guys, how are you doing? I hope you are doing well and welcome to today's episode of learning. So today I want us to handle a topic that is very common, and this affects so many ladies, and so that is menstrual cramping or painful menstruation. So I understand that so many ladies during their menstruation or during their monthly periods, they experience pain. And so today I want us to learn how to treat or how to prevent that pain that comes during menstruation. So, uh, pain during menstruation is medically termed as dysmenorrhea, and we have two types. We have two types of menstrual pain. We have primary dysmenorrhea. I have told you that it has a medical term called dysmenorrhea. So we have primary dysmenorrhea and we have secondary dysmenorrhea. So you find that in primary dysmenorrhea, this is when you experience pain during menstruation, but then all your pelvic organs are okay. Okay, so that means there is nothing wrong in your pelvic area, or your pelvic organs all are okay, but you experience pain. Okay, so this pain can be dull. Okay, it can be dull, it can be crampy, and sometimes it radiates to the back. It is caused by a hormone. There is a hormone called prostaglandin that is released during menstruation, and this what actually happens is this hormone causes the uterine to contract. So those uterine contractions are the ones that cause pain. You find that so there are some those blood clots, when they are being expelled, the uterus has to contract so that they just come out. So those contractions are the ones that cause pain. And also mostly it's accompanied with nausea, vomiting, diarrhea, dizziness, and also headache. Most ladies during menstruation, you can have a feeling of wanting to vomit. Some just vomit, others have diarrhea, others have headaches, others dizziness. You might experience this or not, yes, but this pain comes, it can start during immediately you start menstruating. It can last up to 3 days. Some ladies just experience this pain throughout the menstruation time, maybe 3 days. Others experience this pain once they start menstruating and then it disappears. So we are all different and it affects us differently. So under this primary dysmenorrhea, I want to tell you what you can do, or the remedies to help you to help relieve this pain. Number one, we have exercise. You can exercise, and by exercise I don't mean that you just go out jumping or running. You can do some simple exercises like stretching. You can do yoga. Number two, actually this exercise helps to relieve pain. You can take a warm bath. That time when you have that cramping, just have a warm bath. It helps to relieve the pain because you just feel like fresh. You can drink warm water. Just have some warm water in a bottle and drink it slowly, okay, throughout the day. It helps to relieve this pain. We have application of heat. Under this, what you do, just get a plastic water bottle, put in some warm water, not hot water. Put warm water and then just place it on your lower abdomen. This heat helps to relieve pain, or alternatively you can use a towel. Just get a towel and warm water, then just apply it on your abdomen. That heat will help to relieve pain. We also have you can lie in a prone position, or let me say just lie in bed in a position that you are comfortable with. If it's lying on your back, that is what relieves your pain. Just do that. If it's lying by the side, just get a position that helps to relieve your pain. You also have avoid sugary things. Generally during your menstruation, just avoid eating sugary stuff, because when you take in sugar, I know some of you have experienced this, your menses become heavier, okay, and also it increases your pain. So just avoid eating sugary stuff, avoid chocolates, and avoid a lot of sugar. And then eat a lot of fruits during that period. If you do all this and then still you have that pain, you can now go ahead and use analgesia. Analgesia are those medications that help prevent pain. For example, the most commonly used or the most effective one is brufen. You can get this over the counter in your the nearest chemist. You can just get it, take it 3 days a day, so that it will help stop or prevent this pain. So we have talked about primary dysmenorrhea. So I want to tell you about secondary dysmenorrhea. Secondary dysmenorrhea is pain during menstruation that happens. Initially, you have been menstruating without pain, no pain at all during your periods. But then after some time, or maybe after you hit 25 years onwards, you just start experiencing pain that has not been there. You've been menstruating without having any problem, no pain. But then after some time, maybe after your 25 years, you start experiencing extreme pain, okay? This pain, extreme pain that is accompanied by heavy bleeding or heavy menses. Very painful, heavy menses. And then this pain just interferes with your routine program. You can't go to work, okay? You can't do your daily activities. If you're a student, you can't go to class or you can't go to school. So this means that there might be a problem, okay, in your pelvic organs. You might be having a problem in your ovaries, your fallopian tube, your uterus. One of those organs might be having a problem, because remember, this is pain that just started all of a sudden, something that has not been there, and then it is just so extreme. It is accompanied by heavy menses or heavy bleeding, and then it interferes with your activities, your daily routine activities. So if you experience such kind of pain, I will advise you that you may need to go and visit a doctor so that he can evaluate more and find out where you have a problem. Okay, so you might be having endometriosis. Okay, you might be having uterine fibroids. You might be having pelvic inflammatory disease, or uterine polyps, or any other gynecologic condition that really needs to be evaluated so that you can be treated. Okay, so that is the difference between primary and secondary dysmenorrhea. In primary, this is painful menstruation, but there is no problem in your pelvic organs. Everything is normal. This is just pain that is caused by the uterine contractions when it's trying to expel those clots and that blood, and it's not harmful. I have given you a list of things that you can do at home to help relieve it. If it can't help, go ahead and get a painkiller from over the counter. Number 2, I have told you about secondary dysmenorrhea, a pain that has not, you've been having your normal menses without pain, but then all of a sudden just starting having painful menstruation, excessively painful, accompanied with heavy bleeding, and then it just interferes with your activities, work, class, and anything that you do. And then it is accompanied by heavy periods, or prolonged. It can also prolong. You've been menstruating for 3 days and then all of a sudden it prolongs to 7 days, and then it's heavy. You lose a lot of blood. So in such a case, you might be having a problem. Maybe your ovaries, your fallopian tube, your uterus. You might be having fibroids. You might be having an infection. You might be having endometriosis. And in such a case, you need to go to the hospital for more evaluation. Okay, so that is the simple discussion today of how to treat menstrual or cramping or painful periods. Okay, thank you so much for watching. Continue subscribing, continue liking, share this video, and just let's grow this channel so that we can continue. Learning is a continuous process, and my aim is to just enable that I give you simple tips on our health. Okay, and what you can do just in case you have a problem. And if you have a question, please don't hesitate to just ask me down there in the comment section. I will try in my level best to answer your question. Thank you for watching.